Spinal Truth Show Weekly Podcast Edition. I am Dr. Caleb Slater here with Chris, color commentary and tech guy, as well as Jill, social media guru. We are here to talk about your health, your conditions in a little bit of a different light, a little bit of a different lens, one that I have found to be so effective in treating patients where the common system, the common approach has failed. Today's topic is going to be shoulders, and this one is actually kind of near and dear to my own heart. I had shoulder issues pretty much all my life, and I ended up having shoulder surgery when I was in college.
Really? Now, you used to play baseball, right?
And that's why I've had shoulder problems my whole life. So baseball was life for the longest time, and I would throw until I couldn't feel my arm. I loved it so much, and it got to the point where I just kept getting more and more pain, more and more weakness. I ended up having pain, numbness, tingling, running down my arm just sitting in class in college. And I thought, all right, if it's this bad that it hurts just sitting here at rest, I need to have something done. And now, what I know now, looking back on it, I had the complete wrong care, the complete wrong diagnosis, and I could have saved myself a lot of trouble, a lot of pain, a lot of money, and maybe sharing this, I can do that with the listeners at home. So if you've been following this, if you have numbness and tingling, Chris, where are you going to look?
Your back.
Your spine,
Yeah.
right? It's a nerve issue.
Yeah.
Well, I had numbness and tingling, and I was in physical therapy school. I saw countless physical therapists, including my professors, and outside, actually. I saw a chiropractor. I went to an orthopedic surgeon, my primary. Nobody said, hey, it's a nerve issue. You have numbness and tingling running down your arm, going into these three fingers. And these three fingers is your median nerve distribution. So it's a clear sign, right?
So they all immediately started at your shoulder.
Well, because I said I had shoulder pain.
Right.
And this is what happens. You go to your doctor and you say, my shoulder hurts. They get tunnel vision and they look at your shoulder. They evaluated my shoulder by asking me to move, my arm a little bit. And then what they do next, they imaged my shoulder. And here's what happens so often is that whatever they find on the image, they're going to say, this is your problem.
Sure.
And they're going to find something on the image. I was a baseball player for my entire life up until that point. They're going to find some type of rotator cuff fraying, some type of labral tear, some type of impingement, maybe an osteophyte, so bone spur. They're going to find something. And that's exactly what happened. I ended up having an X-ray and then an MRI with contrast, and they found a torn labrum. So they deemed it a slap tear, which is a very common tear in overhead athletes, and it's where your labrum peels off. And so Do you know what your labrum is?
Nope.
So your labrum's basically the saran wrap for the joint, kind of holds the joint together, and when it's kind of vacuum sealed, and when you tear it, you lose that vacuum seal, so you lose some joint integrity. So they said that this is what I needed to have fixed, and me being a 20-year-old person, not knowing any different, said, this will fix all my problems, sign me up, I'll do it, because I just wanted to play baseball again at the level I know I could have. And I had the surgery, and after surgery, I was in so much more pain. My recovery didn't go well, and nobody could explain why. But again, looking back on it, I see this with all my patients now that have had an underlying nerve issue, and they end up having the surgery, their ACL repair, their total knee, their hip replacement, their rotator cuff repair, and their pain wasn't coming or wasn't solely coming from that injury. It was coming from an underlying nerve issue. And during surgery, not only does that not get addressed, but it often gets irritated. So now they're trying to recover, and you have a normal timeline, let's say for a rotator cuff, within 4 to 6 weeks you're out of the brace and you want normal range of motion restored within about 6 to 8 weeks. You want to start strength training somewhere around 8 to 10 weeks, and then somewhere around 3 months to 4 months, you're getting most of your strength back and you're starting to return to some prior level function. Mm-hmm. I was well behind that, and I couldn't restore range of motion. I was in incredible pain, and again, nobody could explain it. But with my view, it's so easy to explain.
So you were doing exercises to increase mobility and strengthen at some point, but you still had a diminished nerve signal. So you were trying to recover?
I was trying not to just recover the surgical procedure that I had done, but I was fighting against an underlying nerve problem.
Right.
And I see this, I have a chapter, or 2 chapters, I think, in the book with an example like this. One is a young girl who had an ACL tear, and again, an ACL tear, it's a structural issue, it needs to be repaired.
Yeah.
But it was a non-contact injury, so if you want to kind of rationalize why did the ACL fail, well, the muscle protecting the joint failed. Why did the muscle fail in this young athlete? Well, the nerve signal wasn't getting there, wasn't allowing the muscle to fire on time or as strongly, so it makes sense to me. And her range of motion and her strength wasn't coming back. She couldn't do a straight leg raise a few weeks into her recovery, which is pretty abnormal. You should ideally be able to do that day 1, maybe day 2 after surgery. And as soon as we worked on her back, now all of a sudden her range of motion improved greatly, her pain decreased, and she was able to do a straight leg raise. And I wish I knew that back when I was 20, so that I could have applied that to myself, because I tell you, and I know people at home listening to this, they can confirm, shoulder injuries, they're one of the more painful. They take forever to recover, and they're just painful, because no matter what position you're in, your shoulder hurts. Most of the time sleeping, it takes somewhere around 3 months until you start sleeping normally again, or more normal after a shoulder repair. So it messes up your life a little bit.
So is a torn labrum normally a career-killing diagnosis for a baseball player?
For a pitcher.
For a pitcher.
Yeah, for a pitcher, it's up there.
Okay.
You'd probably rather have a rotator cuff tear than a labral tear, because one of them you could fix and strengthen, the rotator cuff tear. The other one, it's a structural issue. And let's say we cut your nice sweater there.
Okay.
Right.
Well, at least you finally pointed out my nice sweater.
We slice a hole. You look great.
Thanks.
We slice a line in it. Now what are you going to do? You're going to sew it back up. Is your sweater going to be the same?
No.
And it's going to be a little smaller, right? Same thing with the labrum. It's not going to be quite the same. It's going to be a little smaller. You're working with less tissue.
So you're going to lose a little of your edge. Yeah. Even if you recover.
You're going to have to the remaining tissue that's there is going to have to stretch out even more.
Okay, and you get to the fact of having a labrum tear. Is it just something that can happen, or is it one of these things because it started in your back and it kind of built to that way where the nerve got diminished and the muscles weren't firing?
Well, why'd the labrum tear in the first place?
That's
right?
what, yeah.
All right, so you can easily make an argument. I was a pitcher. I was overusing and misusing my arm.
Yeah.
Okay. But if the muscles are working properly, if the muscles are firing, so the rotator cuff is supposed to keep your shoulder in its position. Mm-hmm. Do you know what the rotator cuff is?
Nope.
Great. And you know what, and a lot of people too. And
Heard of it, but yeah.
Right. So the rotator cuff is a group of 4 muscles. They're relatively small. For just generalities, 3 of them primarily do the same thing. They elevate and externally rotate your arm.
Okay.
One of them does the opposite. It internally rotates your arm. The main job of the rotator cuff, other than moving your arm into rotation and elevation, is to actually compress the head of the humerus into the socket.
Okay.
Okay, so stabilize it, right? If it can't do its job, next in line is the labrum, right? If that head is translating too much forward, too much back, too much up, then if the rotator cuff isn't keeping it in check, then it's the labrum. So if the rotator cuff fails, now it goes to the labrum. Why the rotator cuff fail? For me, for the way I view things, most of the time it's weakened. And if it's weakened, either it's because of lack of a nerve signal or it's overstretched. And if you've had shoulder issues and you've gone to any physical therapist, one of the first things they do is stretch your shoulder. And it just kind of boggles my mind. Because you sitting here right now in this position, in a pretty normal position, not bad posture, I've seen worse out of you, right? You're stretching your rotator cuff a little bit. Your shoulders are a little forward, a little rounded. your rotator cuff, for the most part, starts here and goes back to here. So if I round that,
it's pulling, it's making pressure. Or pulling.
It's stretching.
Stretching it, yeah.
Right? So more stretching isn't the solution.
It's the opposite.
It's the opposite, right? And then even strengthening. So a lot of people, and I meant to ask you this before we started, but I see so many bad shoulder exercises, so many in this position. You see a lot of rolling a ball on the wall, slapping a ball on the wall.
And that's all the same.
It's all in the same position.
Yeah.
It's all forward, it's all reaching, it's all stretching most of the rotator cuff. You know, again, I'm generalizing. If you want to be like real picky, 2 of them do external rotation, 1 of them does elevation, another one does internal rotation, but we're going to generalize here. If I'm reaching in forward in front of me, I'm stretching the external rotators, the infraspinatus and teres minor. Mm-hmm. So 2 of the rotator cuff muscles. I want to be the opposite. I want to strengthen back into this range. I want to shorten it. The best way to strengthen and remodel tissue is end range muscle contraction to fatigue, end range into its shortened position, right? So many people strengthen the serratus anterior, and in order to do that, it's your boxer's muscle. You have to push forward, right? You have to jab forward, kind of. I'm now still stretching my rotator cuff. So many people do what's called a sleeper stretch, where they bring their arm across, or a choker stretch and a sleeper stretch, where they go like this, and it's stretching your rotator cuff. It's not working.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
So if you're like an athlete or a baseball player and you're doing these stretches thinking like, oh, I'm preparing for my game or preparing to use my arm in a way, and you're doing those exercises, you're actually kind of maybe
probably making it worse. And again, if these muscles are not working, right? What happens to a muscle when it doesn't work? It starts to die, it starts to calcify.
Right.
And we know, so that's tendinosis, tendinopathy. It's a degradation of the tissue, a calcification of the tissue. We know that stretching doesn't work and actually makes it worse. We know that strong muscle contraction remodels the tissue, brings blood flow to the area. So, and it's the same, you know, they used to say stretch before you played, right? Mm-hmm. Now they've gone to more of like a dynamic warm-up, movement, muscle contraction. Same thing. Don't stretch your shoulder, contract that muscle in the range, in its shortened range. So if I'm pitching, if I'm throwing, right? Every throw that I do, I end in this position, a very elongated stretch position for my rotator cuff. So I'm stretching it over and over and over and over again. I want to be able to do so if I do 100 pitches during a game, it makes sense that I need to do 10, 20, 30 movements in the opposite direction to undo the stress that I've put on my shoulder. But it just doesn't get done. And it's such a simple approach. So I meant to ask you beforehand, can we tag an exercise in this video? We'll show the listeners at home, you know, the people that are viewing this on YouTube, or people that can go to our TikTok page or Instagram page. We'll show them a simple exercise that actually works the rotator cuff and works.
So what's the number one best exercise for most rotator cuff issues? So we get this wrong all the time. Most of the time people work this muscle out in its elongated stretched position, but this is what's wrong with it in the first place. You're sitting like this all day long. You're driving, you're reading, you're messing on your phone. It is elongated because your shoulders are rounded all day long. It doesn't need to be further worked in this area. The best way to strengthen and remodel tissue is end range muscle contraction to fatigue. These muscles are primarily external rotators, which means your arm comes all the way out like this. So if I want to really get these muscles to contract, in their range, I'm contracting somewhere here, working my way backwards, not coming forward. A lot of people work it into the eccentric, which is when the muscle's elongating and contracting. No, you want to work it the other way. We made this too complicated. So, what's probably the best exercise for your rotator cuff? Let me show you. Lay down on the floor so you go against gravity. You're going to want to raise your arm up, turn your thumb up to the ceiling, and squeeze your shoulder blade together. And now from here, just raise your arm up to the ceiling without lifting your hips up. It's just your shoulder, scapula moving. You should feel this in the rotator cuff area, which is this back of the shoulder area. If you feel it there, you're doing it right. Note all the other exercises that your physical therapist, your chiropractor, your trainer told you to do for your rotator cuff. Did you feel it in that area? Probably not. We made it too complicated. Make it simple.
So if you are a baseball player, if they built you a specific workout regime that did stretch you properly in both directions appropriately, would the likelihood of these kind of injuries go down?
They diminish, but again, because you play baseball, you're going to move in a certain position over and over and over again. More than another position. So your workout routine should be aimed at the opposite.
Yeah.
The opposite movement. And again, most people don't know this, but a lot of the shoulder movement, so shoulder impingement, is where basically the head of your shoulder migrates up and pinches your rotator cuff muscles, tendons, in between your bone. I'm trying to use layman's terms.
Sure.
That pinching causes pain, that's impingement, causes blood. That blood bruising causes calcification. That calcification is bone spurs. The bone spurs then get in the way of that space and start to rub on that tendon, fraying the tendon, kind of like a rope rubbing against a rock, fraying the tendon, and now it eventually leads to a tear. So, but most people don't realize is that that space is maintained by spinal movement. A lot of your overhead movement, the last 30 degrees of overhead reaching is actually achieved by your thoracic spine moving. So one of the first things that I do for my shoulder patients is I work on their spine. If you have good spinal mobility, you'll decrease impingement, you'll decrease pain, you'll improve mobility, and now you can strengthen in that range to keep it there. And this isn't the treatment that's offered.
So, would the similar things happen to someone who plays like tennis? Because they're not doing the quite overhead, but it's more
They're serving.
serving.
Yeah, so they're not doing as much overhead, but they're serving. So
And you also swing through too. You're kind of similar.
And they also have a backhand too, so they will undo kind of they're undoing their forehand via their backhand. So they have a little bit more, like for baseball, if I'm a right-handed thrower and a right-handed batter, I'm only rotating one direction over and over and over and over again.
Okay. In baseball, though, if you are catching, the impact of the ball, is that with your arm up, does that have any effect on your shoulder?
I mean, I'm sure it could, but catching isn't, because it's still in front of you, right?
Okay, so catching's not really.
Most of the, so I'm not going from extreme ranges. It's in front of me.
Yeah, and obviously baseball is a lot different than football because there is like the impact in football that can cause injuries. Baseball, there's really not much impact.
No, and it's primarily overuse.
It's just overuse.
Yeah.
Are the rotator cuff and I forget what the other one you said.
Labrum.
Labrum. Are those the most common kind of shoulder injuries within that sport?
Yeah, and the other one would be like a long head of the bicep. That would probably be those three, but rotator cuff and labrum are for the shoulder anyway. And then obviously the elbow, you have your Tommy John, your ulnar collateral ligament.
Okay.
But that being said, these are all caused typically by that nerve issue not getting there, by overstretching, underutilizing, and possibly because the nerve signal's not getting there. So a lot of these baseball players, they don't realize it. They're getting pain, numbness, tingling, running down the outside of their arm, down into their hand, and they don't realize that beyond a shadow of a doubt, that is your neck, that is your spine, that is your nerve.
So you had a torn labrum. Now, if you didn't have the spine issue and you had a torn labrum, when you are resting or sleeping, would you still experience pain?
If you were, it would only be local, right where it's at. And the answer to your question is probably not. So right now, again, I have a torn labrum in my shoulder.
Yeah.
I retore it. I am fine right now. I'm fine sitting here. I play racquetball. I work out. I don't have any pain from it whatsoever. In my book, I have an example of a young male who was playing lacrosse, and he had bilateral hip pain. You have a labrum in your hip too. The hip and the shoulder are pretty similar.
Okay.
He went to the doctor. The doctor did imaging, said, "Here's your problem." Did surgery. It didn't go well.
Mm-hmm.
His pain wasn't coming from his torn labrum. His pain was coming from his back. You probably have a tear somewhere right now. Meniscus tear, labral tear, rotator cuff fraying, something, right?
Falling apart.
Just looking at you, like I know you got something.
Wow.
Right?
I got something.
But the point is, most people have some degeneration, some overuse, and they don't have pain from it. Pain occurs when you do it, when you recently do it. Like if I tore it right now, my shoulder would hurt. It would probably hurt for a few days, maybe a few weeks. But then eventually that pain would go away, right? That pain would diminish. And if it was pain from the labrum, it's typically only when you're taxing that labrum. So like at a certain range. So like right now, just sitting here, I'm not really taxing. The labrum's job is to keep my shoulder in a position.
Yeah.
Right? So I'm not really taxing it. But if I went as far back as I could with my arm, now I'm starting to tax a certain position, part of the labrum.
And I feel like most people who have a pain when they're doing a certain specific thing probably wouldn't go to the length of getting surgery because it's not something to deal with. But when it's a constant pain at any point in your life and you feel like, oh, well, this has become more of an emergency or more of something that needs to be dealt with right away. Because like you were saying, you were in class, you were laying in bed, anything, it was just a constant pain that wouldn't go away.
And so for me, it made sense. If I'm in that much pain at rest,
exactly,
then I need this fixed. But it was the opposite. If I was in that much pain at rest, it wasn't my labrum, it wasn't my rotator cuff. So maybe that's the biggest take home for anybody listening to this, is that if you're in pain at rest, if you have pain, numbness, tingling running down your arm, it's not your rotator cuff, it's not your labrum, it's not your impingement, it's your spine. Get your spine treated, get your neck treated, get your thoracic spine treated. That will solve your issues. And now whatever you're left with, maybe a little bit of weakness, maybe a little bit of pain from the shoulder during specific movements. Now you can address it because you've addressed the main underlying cause, and now you're set up for success in your shoulder recovery.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
So a lot of people who probably listen to this are parents, young kids getting into sports. Is this, what would you say to someone who has like a 6-year-old to 14-year-old or something who's heavy into baseball?
Well, I'll use my daughter. So I have an 11-year-old daughter. I have 2 daughters, but the 11-year-old is into softball. Mm-hmm. She's not into softball the way I was into baseball. You know, I would go throw a ball against a roof and let it roll down and do that, or ball against the wall and
anything. Yeah,
I play catch with myself basically, right? I have to
She has friends and you didn't. That's
right, exactly. Well, I was an only child. She has a sister, but you know, she's not into it the way I was into it, but she'll still play. And she immediately was starting to get some outside of her shoulder pain. So knowing what I know, I had her contract that muscle in a shortened range, and I had her work on her neck and upper back, and that took the pain away. She was getting a nerve issue. She was stretching the nerve too much, too quickly, too over and over again. And again, she's not playing all that much. You know, she plays seasonally, and they have 2 to 3 events a week.
Yeah, but still was noticing that. I think a lot of people, as you get older, we apply so much to, well, we're just older now, so this is how our bodies are. But that maybe potentially doesn't have to be the case, right? If you are maintaining and doing things and stretching the appropriate ways, increasing your strength.
I mean, you could definitely diminish it, right?
Sure.
If you know, and again, she's throwing over and over and over again.
Yeah.
So knowing if you're moving in that movement so often, move in the opposite movement.
Yep.
And it's not that complicated,
it's
right?
A simple concept.
The complicated part is look at your spine. But again, that you can kind of simplify that too. She's bending forward. She bends forward in class all the time. Everybody's bent forward at their neck and upper back. So I have her do a foam roller exercise where she extends that area. She just moves in the opposite direction.
I'm glad you brought up softball too, because I used to play softball and I was the emergency pitcher for the emergency pitcher. And it's interesting because I was thinking about how pitching for softball is almost the opposite because you're going back in that windmill and ending lower. So I actually looked up if there's any differences between injuries between softball and baseball. And they do say that baseball pitchers are more likely to suffer from shoulder injuries. But the one thing I thought was interesting, too, is that shoulder injuries are more evenly distributed among softball players between pitchers, catchers, and first base players, which is kind of interesting because for baseball, I feel like it's not. It's obviously more prominent with pitchers, and for softball, it's a little bit different.
Well, and for me, it makes sense. It's evenly distributed because they're pretty much evenly throwing the ball overhead.
Right, and I think, too, for softball, you don't have as much force coming down because you're kind of like whipping it through and you're using more of your hips when you get to the bottom rather than...
It's supposed to be more of a natural motion for your shoulder.
Yeah.
And not only that, it's just not putting fuel on the fire, right? Like if you're a baseball pitcher, whenever you throw the baseball, you're throwing overhead. Then when you go pitch, obviously you're throwing overhead. If you're a softball pitcher, whenever you play baseball, you're throwing overhead, but when you're pitching, you're not doing that same motion. So the repetitive motion, the overuse is diminished a bit because you're using it differently.
What about something like golf? Is that is there a common shoulder injury?
No, not shoulder. Wrists and elbows.
Okay, that makes sense.
For golf. There's actually like golfer's elbow, you know.
Are there any other sports? I mean, basketball.
For shoulder?
Yeah.
I would say basketball has shoulder impingement. Baseball is the
number one.
The main.
Yeah, and it's mostly pitchers, I would assume, but yeah.
Yeah, I mean, you get other ones.
Are there any common activities besides sports related that you see? You know, I know you mentioned a lot of people, like if they're
specifically for shoulders.
Yeah.
Well, honestly, I kind of what you were just mentioning. I think the position that we're in all the time. You wake up from sleeping, and if you're a side sleeper, you've scrunched your shoulders together, and you've been rounding your upper back for 8 to 9 hours a night, or however long you've been in bed. Then you wake up, you sit at the breakfast table in that position, and you're probably on your phone during that time. You drive to work, and then you work on your computer for 8 hours. You drive home, you cook dinner, and then you sit on the couch and you watch TV and you mess around on your phone, right?
It's all the same.
It's all the same position.
One of the things I do is when I sleep, I put my shoulder underneath my arm, and often I'll get this pain from my neck to my shoulder. So knowing that that's a common way I sleep, is there something I should do after I wake up if I have that shoulder pain?
Pretty much. So I like that you didn't say, is there a different way to sleep? Because that's what most people would say.
Yeah, I can't. I get to sleep the way I sleep.
And that's kind of my answer to most people when they say that. I'm like, look, like there are some better than others, but for the most part, however you sleep, you know, do stuff during the day to make you be able to tolerate the position you sleep in. So as soon as I wake up, I do a foam roller. I extend my thoracic spine. I do some neck exercises.
So that's the one where you kind of Push your head back.
Push your head back.
Yeah.
So my neck's going back, my thoracic spine, my upper thoracic spine's going back, my shoulders are going over my head. I'm undoing the position that I've been in for 8 to 9 hours. And I feel so much better when I do that.
And how long does that take?
Seconds.
Interesting. And just that little bit of effort every morning makes a noticeable difference.
Yeah, so let's say less than 30 seconds doing that. But then I also do a few strengthening exercises in that range. Like the foam roller will get you moving in that direction, which is great. Now you have mobility. But if you don't do something to strengthen in that range, to stabilize in that range, as soon as you've been sitting for a half hour, it's just going to come back and you're going to have to do the foam roller exercise again. You know, you need to have strength in that range.
That makes sense. I think some of the key takeaways then from this conversation are, one, if you're an athlete, learn those exercises to extend your body in both directions and strengthen in that way.
I mean, 100%. There's a better way for shoulder recovery. There's a better way for shoulder prevention, and it's mobilize your neck and thoracic spine into extension and strengthen your shoulder in its shortened position behind your back.
And then also, I would say, as a parent, don't take for granted their youth that their bodies are impenetrable to these things. They should also be doing these appropriate exercises when playing sports.
Well, and also, too, if they do get symptoms, it's unlikely that the muscle and tendon failed in those children.
Yeah.
It's more likely their spine failed.
Yeah.
So get their spine looked at before you get a waste of time rehab or surgery, or your kid misses a season, or they're in pain, or they start compensating, which is what I did. And now you have other problems.
I'm glad you mentioned the muscle part, because I pretty much just assumed that like shoulder pain was from the muscles in that area, and I never would have thought, oh, it's probably my spine. I just would have thought it's because I'm using it so much, those muscles are tired. But
It is almost always a neck and upper back issue. So anywhere from about C3 in your neck to about T2, T3 in your upper back. So your mid to low cervical and very upper thoracic area. That's a good place to wrap up for our show today. If you're at home and you were listening and you have a specific question that we didn't answer, you can reach out to us, info@thespinaltruth.com for email. We are on TikTok and Instagram as well as YouTube. You can leave a comment down below. We will do our best to answer your questions. Again, we have a unique view, a different view that has served our patients so much better than the common approach. Next week, we are going to discuss some of the failings of the healthcare system. It'll probably be, a 60-part episode for how much we have to talk about. So keep following us, the Spinal Truth Show, weekly podcast edition. See you next week.